Hey everybody, welcome to this Caregiver Coffee. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish, and I've been partnering with the Council on Aging in St. Tammany for over 10 years. All of that time as a caregiver support group facilitator, and half of that time bringing you Caregiver Coffee, just small bits of information, about 10 to 15 minutes, information about getting older, information about health, information about caregiving, and independent living, all into help support and help keep people in active as long as they can be, and in the setting that they wish to be, with which for most people is they wish to be at home, um, home in their comfortable environment. So we try to do that with some of the tips. And we do this through, well, at least this video series that we are working on is about the 4Ms. The 4Ms, talk about in some videos, but not everyone, but a review of the 4Ms are what matters to the older adult, medications, mentation, and mobility. So those are the 4Ms. And basically all of someone's healthcare can be looked at through that framework. And today we continue on the third M of mentation, where we're going to talk about delirium. We've already talked about depression. Today is delirium, and I have a really good patient and family guide from the American Delirium Society. And I will include a link to the PDF that I'll be reviewing with you in the description of this video. So these are the experts, right? The American Delirium Society. So I think you're really going to enjoy that. Before we dive into delirium, I want to tell you a little bit, as I do in every intro of these videos, about the caregiver support group that I facilitate. They are on Tuesday evenings, every Tuesday evening, basically of the year, from 6 p.m. to 7:30 p.m. And the pattern that we follow is this one. The first Tuesday of the month, we're in person at the Slidell Senior Activity Center. The second Tuesday of the month, we are on Zoom, so you can join via your smartphone, your tablet, even your landline phone or computer. The third Tuesday, we're at the Covington Senior Activity Center, and then the fourth Tuesday, and sometimes if we meet on a fifth Tuesday, we are back on Zoom, phone, computer, etc. So we're never in both in person and online. It's either or. So to keep up with all of the dates and any kind of changes, make sure that you've joined the specific email list for the support group, so you can get email reminders and you get new calendars. And you can get a new calendar and find out how to join the mailing list by going to coastseniors.org, going to caregiver services, and then you'll find my picture, and then you'll find the latest calendar of where we're going to be and when. We publish this every 2 months. Right now, we're towards the end of as I'm recording this, we're at the end of June 2025. We'll be coming out with a July and August 2025 calendar out soon. So we try to keep that updated. And I also email that out when we have a new one for those who are already on the email lists. So basically every Tuesday. Of course, we don't meet on Mardi Gras. We push that usually to Thursday of Mardi Gras week. We won't meet on Christmas and 4th of July and stuff like that. But a great thing, that's why you want to be on the email list and get the calendar, so you'll know that if a holiday is on a Tuesday, you know when we're moving it to. All right, let's dive into this delirium guide for patients and families. And if I feel like, I'll probably comment on some of this after we go through it, if I have anything to add. All right, so this is 6 pages. I'll read most of it. I'll certainly highlight all of it, and I'll get to as much as I can. Like I said, I'll link to the video in the description. So what is delirium? It is a sudden confusion that can happen when someone is sick. It causes big changes in how they think, act, and move. It can sometimes be prevented. And if it does happen, it needs attention and treatment right away. All right, just need to start my timer so I don't go 20 minutes on you. All right, what does delirium look and feel like? Sudden behaviors to look for, because we as caregivers, as family members, it's up to us to recognize this, um, and as well as medical providers, right? But if they're not seeing it, or we're seeing it at home and the medical provider's not there, it's up to us. So what does it look and feel like? Trouble thinking clearly, trouble paying attention, trouble remembering, being unsure about what is happening, trouble understanding what they're being asked to do. So if you're giving instructions and they look confused or not sure of what is going on, why they're having to do things, why they're being asked, they may have trouble talking, such as speaking fast or even slow, mumbling, not making sense, reverting to speaking their first language if they know other languages, feeling afraid that people are trying to harm them. So that's also known as paranoia. Seeing, feeling, or hearing something that is not there. So hallucinations. Feeling nervous, being restless or sleepy. These behaviors may come and go. They may get worse in the evening or night. Alert your healthcare team if you experience any of these symptoms of delirium, and doctors can then investigate this change and take action. I would say nurses as well. Nurses are well aware and trained in delirium. And just kind of looking at this list that I just read off, we could read this and say that these could be symptoms of dementia. The difference being dementia being a more of a permanent onset, whereas delirium, like sort of a slowly these signs and symptoms become aware to you, and so delirium is a faster onset. Like it almost happens it might feel like it happens out of nowhere. So it's a sudden onset, not this long, slow progression. So what causes delirium? And I'm wondering if there's some things on here that are going to be new to you. I think you'll find at least one thing, one surprise. One or more of these can cause delirium. Illness such as a urinary tract infection or pneumonia, lack of sleep, dehydration, fever, pain, surgery or anesthesia, trouble urinating or having a bowel movement. So that I don't see the word constipation on here, but that's where I would put that, trouble urinating, and then not having having trouble having a bowel movement can cause constipation, or can cause delirium. Trouble breathing can cause it. Electrolytes being too low or even too high. For example, this can be potassium, calcium, sodium. Medication, and that can be prescribed medication or over the counter. Quickly stopping alcohol, drug, or medicine, and that can be medicine, could be something with alcohol. It could be an opioid, it could be sleeping medication, be nicotine or recreational drugs, or having a terminal illness. And delirium is a warning sign. This is in bold. Warning. Delirium is a warning sign that the brain is not working because the person is not well. Who is at risk for delirium? People who are 65 years old and up, or the very young. And they're defining that to be under 5 years of age. Having poor eyesight or hearing loss, are very sick with multiple illnesses, are taking many medications, so polypharmacy, we've talked about that before here. Having a history of delirium could make someone more susceptible in the future. Having dementia or another brain disease. Let's see. I would even add to this. I mean, these are the experts. But I would, and they mentioned this before, I would say someone who just had surgery and they're in the hospital. Just by virtue of being in the hospital can be very disorienting and cause delirium. And we hope that that the medical team, and if not the medical team, us, that we recognize it, because the confusion might make someone make us think like, oh, this our loved one has dementia, when it could be, remember, that quick onset or early or fast, sorry, fast or sudden onset. So how do delirium and dementia differ? So there's a table here. It's not a huge table. And some of this we talked about. So dementia is a slow and steady decline in thinking, and delirium is a sudden decline in thinking. In dementia, changes occur over months to years, and delirium changes from hours, anywhere from hours to days. Dementia is progressive and long lasting, and delirium usually resolves itself with care, with treatment. Having delirium can increase the risk of memory problems in the future and may make dementia worse. So while delirium is not dementia in that it's not permanent, delirium should be taken very seriously because it can lead to dementia. The goals of the healthcare team are, number one, to prevent delirium when possible. Number two, detect delirium as early as possible. Number three, identify and treat the cause or causes of delirium according to the person's goals of care. For example, this may involve physical and mental status examinations, lab tests, and imaging such as CT scans and x-rays. And number four, and the final one, provide a supportive, safe, and comfortable space. What can you do to help your loved one? You know your loved one best. Please tell the staff about your loved one's normal ability to function and think when they're not sick or hospitalized. Knowing someone's normal function can help the healthcare team better identify where there is a change, and possibly identify the delirium. So talking about the baseline, like what is your loved one normally like? And then alerting that to them. List of helpful tips to prevent delirium. And here we're on bottom of page 3 of 6. All right, visit as often as you can. During those visits, remind them of the time and day and where they are. You can even bring an easy to see clock or a calendar to help them. Bring in familiar items. So photos to stand up, photo frames, photo albums, blankets, pillows, things that are familiar and bring comfort. Their favorite Afghan, what else? Music can be great. Assist your loved one with their eyeglasses, so that means like cleaning them, hearing aids, making sure the batteries are charged, or there's charge to it so they can hear that they're clean and they're working, and dentures that they if they wear dentures that they are there and they can use them. Promote any typical routines and speak of familiar topics. Encourage your loved one to be up in the chair for meals. Provide a change of scenery during the daytime. If possible, go outside, go outdoors. So you're trying to let them, in a sense, keep their circadian rhythm. Like, it's daytime right now. We don't need to sleep, and just kind of so they can see the changes and kind of be in the rhythm of the day and the night. Keep shades up during the day and dim the lights at night. Discourage daytime napping. May ask the staff for ear masks and earplugs at night if needed. Discuss with the healthcare team your loved one's preference for meals, their sleep patterns, what they want, and activities. Make sure they have a current list of medications that your loved one has been taking, and that's both prescription, over-the-counter, supplements, herbals, anything like that. The healthcare team, as we've said in some of the medication videos, It's so important. You may not think it is, or we may not, sorry, you may not automatically think, oh, they need to know about this vitamin or this supplement that I'm taking, but they really should. It's just part of looking at that individual as a whole and what they have in their body or could have. Um, how you look at discuss with the healthcare team how you can help participate in care of your loved ones. So maybe you can assist them with their eating and their drinking, exercises, hygiene care. So it doesn't have to go. I mean, typically the healthcare team will do that, but if you're able to do that, that allows you to spend time with them, and it also allows them to be oriented to where they are and et cetera. So if they see those familiar faces, remember, we want comfort and a safe place for them. If you see any changes in their thinking or their behavior, or if something is not quite right, let the healthcare team know, because families are often the first to sense these changes in their thinking and behavior. If someone has dementia, the following will be helpful. Continue the above list of things to prevent delirium that we talked about. Speak in a calm voice facing that person. Use simple and short sentences that allow time for the person to answer. If they're scared, if they are scared or talking about things that don't make sense, remind them of their current circumstances, but at the same time, avoid correcting them. Use distraction and talk about something else. Listen to their fears and reassure them that they are safe, that you are there to take care of them, that you love them, etc. These things to comfort them, honest things to comfort them. If they're restless, consider placing familiar or interesting items in their hands. So here it mentions stuffed animals. It didn't before. I just happened to think about that. But here they specifically say stuffed animals, rolled up squishy balls. You can even get things at toy stores or on Amazon, like different types of textures and things so they can do things with their hands to touch and get this kinesthetic feeling. Encourage and assist with eating and drinking if allowed. All right, let's see. What to consider for your own health and well-being as a family or friend. Sharing, visiting with other family members or friends, not just taking it on yourself. Take breaks and eat. Remember to eat. Bring food or go to the cafeteria if they have one at the hospital, if you're at a hospital. Try not to take any negative comments from your loved one personally. That can be very difficult to hear and to try to shake off. Consider recording a loving message for the person. Let the healthcare team know that if you have questions or need more support yourself. They're there to help the patient, but they're also there to help you as well. So ask them, keep them aware of how you're doing. What to do when a person with delirium returns home. After having delirium, the person may or may not be back to normal. The following tips to support recovery may include these things. Let me stop our time because we're getting close. Healthy eating and drinking, movement, so exercise, walking, dancing, things that get them moving that they also enjoy. Keeping the brain active, using tools such as planners, lists, routines. I really like their clock idea. There are clocks that are $30 to $40 on Amazon that are pretty big. They're digital. And they have the day, they have the date, they've got the time. They're big, so they're easy to read. Being social, having healthy sleep routines, so having sleep hygiene. Only taking over-counter medications and prescriptions that are prescribed by the healthcare provider. It might be that in this process the medical team decides to optimize their medication list by maybe taking some things off. So that may be something that helps according to your loved one and the team as far as what they do uniquely for your loved one. Ask the provider before beginning herbs or supplements. Do not use alcohol or drugs, illegal drugs. Keep all the follow-up appointments. Contact your healthcare provider if symptoms do not improve at home or they get worse at home. New symptoms of delirium develop. So go back to the very top of this list. What does delirium feel and look like? Caring for your loved one at home does not, if it does not seem safe, if they're aggressive or they're violent, eating, drinking, or communicating stops. These are all reasons to contact the healthcare provider um, through the portal. Pops, I would even say, before there's a discharge, or you wrap up the appointment to go home, that you discuss with them, well, how do I reach you? Um, how do I best reach you? Is it online portal? And then what are circumstances in which you might need to go to the emergency room, especially if it's over the weekend? All right, and wrapping up with the key points, the earlier that delirium is detected and treated, recovery improves. Family and friends are important to early detection of delirium. It can be very scary for the person and the family, so sharing your feelings and seeking help from the healthcare team is important. Delirium is a warning sign that the person needs help right away. So, and that's in bold and blue color too. Of all the key points, that's the one that stands out. Delirium is a warning sign that the person needs help right away. And lastly, the last key point is if you see any changes in their thinking or behavior, or if something doesn't seem quite right, let the healthcare team know right away. All right. So, and again, this is from the American Delirium Society. I feel very fortunate that I found this patient guide from there. I was looking at a lot of different organizations, and these guys are the experts. So this will be linked in the description of the video. So I hope that you'll take advantage of this. It's a 6-page PDF. It's all free. You can print it. You can email it to others. You can post it online. So yeah, so thanks for your attention. This is a really important topic. So hopefully you don't need this right now, but you now are aware of these things. So I hope that if this presents itself, and it's very likely it might happen to all of us at some point in our lives, that it sounds familiar, you're able to access this, or at least tell the nurse or doctor, hey, I think my loved one has delirium, because they don't normally act like this. So thank you again for your attention. Thank you for supporting the Council on Aging in St. Tammany. I look forward to being on your smartphone or your computer in the future on a Caregiver coffee. Until then, take care, and I hope you stay well. Bye for now.